Hi, I am Mr. Saror Hussain, intern of Meningeal College. In this session of nervous system examination, I demonstrated the examination of facial nerve and sign of meningeal irritation. So, I started my examination with the examination of facial nerve. It is very important. Most common given cranial nerve examination in Viva, in any session of Viva, it's most commonly given examination. Examine the facial nerve. So examine the facial nerve. I already take the consent, greeting, introduction, consent, exposure, properly exposed, and facial nerve examination. In case of facial nerve examination, you have to maintain a rule. Keep it in your mind. Don't just say to your professor that it's a rule of 5. You just ask 5 questions, 5 inspection, and 5 examination. Then 5 question just begins with আপনি কি মুখে স্বাদ পান, খাবারের স্বাদ পান, আপনি কি খাবারের স্বাদ পান? হ্যাঁ, ইয়েস। আর আপনি কানে স্বাভাবিক শোনেন? হ্যাঁ। সেকেন্ড কোশ্চেন। থার্ড কোশ্চেন, খাবার সময় কি খাবার আপনার মুখের কোনো পাশে জমে থাকে? না। পানি খাবার সময় কি পানি গড়িয়ে পড়ে? না। মুখ দিয়ে লালা গড়িয়ে পড়ে? না। হ্যাঁ, you just keep in your mind, you just ask him to 5 question and 5 inspection. From questioning, you just questioning and inspect the face. What are the things we inspect? We inspect 5 things. First of all, we see the wrinkles, the mark of the wrinkles. Here is well present, the mark of the wrinkles. Keep it normal, mark of the wrinkles are present. And then we see whether the eye is open or closed. Because facial nerve, the function of facial nerve is close the eye. And when you lost your facial nerve, eye just widely open. So you see the furrow, and then see the eye, whether the eye is widely open or not, and then see the nasolabial fold, whether the nasolabial fold is pattern or disappear, whether the nasolabial fold is pattern or disappear, and then you see the dropping of the angle of the mouth, and then you see overall facial asymmetry. So what are the things we see in inspection? 5 things common: furrow of the wrinkle, whether the eye is widely open in one side, whether the nasolabial fold is pattern or not, and dropping of the angle of the mouth, and overall facial asymmetry. And we then done 5 examination of the function of the facial nerve. We know all the muscle of the face which are responsible for facial expression are supplied by the facial nerve. All the motor supply of the face is given by the facial nerve, whereas the sensory supply is given by the trigeminal nerve. And we just elicit this function. We just examine the function of the facial nerve. First of all, we do 5 things. Initiated with the frontal belly of the occipitofrontalis muscle. দেখেন আমার দিকে তাকান, ভুরু কোঁচকান। You just demonstrated these things. আমার দিকে তাকান, ভুরু কোঁচকান, এরকম করেন। He just can do this. And you doesn't put your hand over the head, because our honorable professor Sobur sir doesn't like this. So doesn't put your hand over his head. Just say আমার মতো করেন, চোখ বন্ধ করেন। He can close his eyes. In case of facial nerve examination, facial nerve palsy, he can close his eyes. And this is called try to close your eye. When you attempt to close your eye, the eyeball move upwards and outwards. This is called Bell's phenomena. This is commonly present in case of normal person, but it is visible in case of facial nerve palsy because eye cannot close properly. চোখ বন্ধ করতে চেষ্টা করো। Eyeball just move, roll upwards and outwards. This is called Bell's phenomena. So we see কপাল কোঁচকান, চোখ বন্ধ করেন, চোখ জোরে বন্ধ করেন, আমাকে খুলতে দিবেন না। We just see the strength of orbicularis oculi, and then come to the point, গাল ফুলান. This is function of the vaccinator. ফুদেন, orbicularis oris, দাঁত দেখান, angularis oris, দাঁত দেখান ভালো করে। This is a function of angularis oris. So we see in mouth, we see 3 things: গাল ফুলান, ফুদেন, দাঁত দেখান. In eye, we see 1 thing: চোখ বন্ধ করেন, চোখ জোরে বন্ধ করেন, আমাকে খুলতে দিবেন না। First you see চোখ বন্ধ করেন, চোখ জোরে বন্ধ করেন, আমাকে খুলতে দিবেন না, কপাল কোঁচকান। Yeah. So in examination, quick recap of the facial nerve examination, we just do 5 question, 5 inspection, and 5 examination. কপাল কোঁচকাইতে পারতেছে কিনা, চোখ বন্ধ করতে পারতেছে কিনা, গাল ফুলাইতে পারতেছে কিনা, দাঁত দেখাইতে পারতেছে কিনা, ফু দিতে পারতেছে কিনা। And here the another function, facial nerve is a mixed nerve. You know the facial nerve is a mixed nerve. We have both sensory function and spatial sensory function, such as take the taste sensation from the tongue. So if professor asks you why you doesn't examine the taste sensation, you just complete your examination without examining the taste sensation. যদি এরকম কোনো কোশ্চেন করে আপনি স্যার, তাহলে আপনি বলতে পারেন স্যার আমি পেশেন্টকে কোশ্চেন করছিলাম যে সে মুখে স্বাদ পায় কিনা, সে বলছে সে মুখে স্বাদ পায়, সো আমি আর ফার্দার এক্সামিনেশন করি নাই, বাট এখন আমি এক্সামিন করতে চাই। তারপরে আরও ফেসিয়াল নার্ভের ফাংশন আছে, বিকজ ফেসিয়াল নার্ভ মেনটেইন দ্য স্ট্রেংথ অফ দ্য স্টেপিডিয়াস মাসেলস। ইফ ইউ লুজ ইউর ফেসিয়াল নার্ভ, নর্মাল সাউন্ড উইল বি ইনক্রিজড, দিস ইজ কল্ড হাইপার অ্যাকুয়েসিস, such as whispering sound will be exaggerated in your ear. So you can test it by just take some ear and scratching sound will be here. Can you hear anything? Is it too much or normal? Normal. You can test it both side. Then professor asks you why you doesn't include it in your 5 examination, rule of 5. Then you say, sir, I asked about, আমি পেশেন্টকে জিজ্ঞেস করছিলাম সে কানে স্বাভাবিক শোনে কিনা, সে বলছে কানে স্বাভাবিক শোনে, সো আমি এক্সামিনেশন করি নাই, বাট ফার্দার ইভ্যালুয়েশন I wanted to examine these things. So you just complete your whole examination by 15 points, 5 question, 5 inspection and 5 examination. And now I examine the sign of meningeal irritation. For examination of sign of meningeal irritation, you have to remove the pillow from the head side. Remove the pillow from the head side. Our honorable Professor Subur sir preferred that you should first move the head right and left. You can do it, or you can do it in front of our professor, but for other professor, it doesn't mandatory to do it. And then you have to hold the hand by use your two hand. Hold the head by use your 2 hand, and try to touch the chin over her sternum. If you feel passive resistance, then neck rigidity is present. You just hold the total hand of the patient. Total head of the patient over your hand and try to touch it in the chin. If you feel passive resistance, then it will be counted as neck rigidity. Just see the neck rigidity, so you also see the Budenski sign. In illustration of the Budenski sign, if you flex the neck, involuntary flexion of the hip. So when you just flex the neck, involuntary flexion of the hip, it is called Budenski sign. And now we examination of the Carnic sign. For Carnic sign examination, you have to flex the hip at 90 degree, knee at 90 degree, and hold your left hand in the hamstring muscle, and just try to straight up the leg. Try to straight up the leg and feel passive contraction in the hamstring muscle. Hip 90 degree, knee 90 degree, hold your left hand over the hamstring just like this, and feel the passive contraction when you try to straight the leg, and this is called Carnic sign. So we see Carnic sign, Budenski sign, passive flexion of the neck, involuntary contraction of the hip, and also see the neck rigidity. So these 3 signs are the cardinal for sign of meningeal irritation. You gauge it. Remember, you gauge the sign of meningeal irritation in 2 diseases. Commonly, remember the 2 diseases you can find it. Number 1 is meningitis, and number 2 is subarachnoid hemorrhage. Thanks for watching.